Often we fear the acutes. Fear makes the wolf appear bigger than he is. Man is a rational being. Yet when faced with fear or anxiety situations, the decision he often takes is irrational. This is very true in illness, especially in acute illnesses. Fevers, infections, typhoids, tonsillitis, asthmas, acute appendicitis. The times when we should go to a homeopath are times when people in fear and anxiety take the decision not to go to a homeopath, even if they've otherwise been taking homeopathy. So what is the cause of this fear? What is it that makes them take these decisions? It comes from misinformation, or sometimes just lack of information. So what should we do about this? How can we allay these fears? Let us look at the misinformations. The first is that homeopathy is slow in its action. This is an acute illness. We need to do something to make the person well immediately. This is absolutely not true. An acute illness needs a response that is acute in nature. That will happen really quickly. A case that comes straight to my mind follows what Dr. Paresh said with the case of asthma, where a child, this is a child I saw in his most acute state, perhaps the most acutely breathless child I've seen in my clinic. The child was panting. The pediatrician with whom we are working in tandem with called me and said, this child for sure we need to admit. We will have to put him on drip. We'll have to give him steroids. He will otherwise go into status asthmaticus. The asthma will stay and will be very difficult to respond. I asked him, I said, how long can we wait to see a good response? He said 3 to 4 hours, with the understanding of the patient, with the ability to get the exact remedy, with the confidence that homeopathy works and does work, and with the support that the family and the grandparents provided this patient. I would like you to hear from the child's mother how quickly the remedy acted in this case that was going into a crisis asthma state.
I know it was around 4 in the evening. How long do you think before that day you felt he's settling?
At 39, I saw a marked improvement. Almost about 20-25%.
So from 4 to 8:39, 25% improvement. Child was able to sleep now, was able to talk. It was obvious that that panting respiration had gone away. That is the quickness, the pace of the action of the remedy. But the second misconception that often beleaguers homeopaths and their patients is that this is high fever and thus we have to take antibiotics. Fever is not a problem. In fact, fever is part of the solution. Why is there fever? When there's an infection in the body, the organisms are being attacked by our own body's police force, the white blood cells. These white blood cells chemically as well as through actually eating away the organism are fighting this infection. In this fight, they are producing a chemical called leukotriene. The leukotriene raises the temperature of the body. Thus, the fever that comes on is a sign to you that the body is actually fighting this infection. Not only that, this fever is not liked by the organisms, and thus the fever actually does not allow these organisms to propagate. Thus, fever not only tells you you're fighting infection, but is beneficial to you. Nevertheless, we do keep the fever under control, not let it go very high. And we do this by the use of lot of fluid, hydration. You must give the child 10 to 12 glasses of fluid minimum. Count the glasses that they are taking. Tepid sponging, not cold water, not eau-de-cologne. Judicious and sparing use of paracetamol. That is all that is needed with the correct homeopathic remedy. Within 2 days, everything settles down. The other idea that is there in the minds is that if it is a bacterial infection, then we cannot do homeopathy. Homeopathy will not work in bacterial infection. This comes from a lack of understanding. Whether the organism is bacterial, viral, protozoal, fungal, all these organisms have an antigen on them. The body simply recognizes it as a foreign object and an antigen. The white blood cells, the T cells and the B cells, produce the antibodies that are going to attack this antigen. It doesn't matter to the body if it is a bacteria, viral. It is perfectly capable of handling this problem. Even if we remove these misconceptions, this misinformation, the question in your mind, the question that you can ask is, why do homeopathy at all? For that, I'd like to tell you that as this antigen-antibody reaction, which creates fever, it also creates a memory in the B cells and the T cells. Thus, the next time the body is faced with the same or similar infective organism, it already knows what antibody, what arsenal, what weapon does it need to use against this organism. And thus, the effect of that infection will be much milder. The intensity will be much less. In fact, it might not even allow this organism to enter the system. Thus, homeopathy acts as an ideal preventive medicine when you give it during the acute. That is very, very important. Thus, it builds immunity, as Dr. Paresh said, the case of asthma, where the frequency, the intensity of the episodes and the duration of the episodes widen, and finally there is nothing left, no episodes left, because the immunity has fully developed enough. However, when we, instead of doing homeopathy, if we chose to do antibiotics at this time, they work, but they will kill the germs as well as kill the white blood cells, and thus there is no possibility for developing the immunity at that time. And that's why we feel so extremely weak if in an infection we have been treated with an antibiotic. I'd like you to hear what happens when you take homeopathy in an acute episode, how the immunity builds up, how the patient feels, from an eloquent patient, also the mother of the child I treated. The child had typhoid fever, a bacterial subacute infection, again where many people feel we only have to give an antibiotic here. This child, with the confident remedy support of the family, was treated, and we hear the effect from the mother.
I completely don't agree with any of these things. I feel homeopathy is much faster. There were not many side effects. I realized that after he recovered from typhoid, he did have the weakness, prolonged 1 month weakness, which normally I've seen, and I myself have experienced because as a kid, and I had typhoid. I realized I went through weakness for another month with antibiotics.
So she clearly knew the difference, because having herself experienced what happened in typhoid with antibiotics, she saw how quickly, gently the child responded and regained his strength and activity much quickly. But not only does homeopathy look after the acute illness at that time, the acute is an opportunity for you, an opportunity to improve your child's health, which you should not miss. What do I mean by that? The body is a self-healing mechanism. The human being is a self-healing organism. We are able to cure diseases, look after problems theoretically by ourselves. We should be able to do so. Then why so many diseases? Why do we succumb to the infections? Why don't we get okay? Why so many autoimmune diseases? Why so much disease around us? Because there is something wrong in the basic programming. In today's technological era, if I use the word, it's a problem with the hard drive. It's an error in the hard drive. This error in the hard drive, if we understand it homeopathically, creates within the person like another movie that is running inside. So it's like the world around is a story, a movie. Inside us, because of this hard drive error, runs another movie. So while other people are watching something else, we are watching and reacting to something else inside us. This we call in homeopathy a false perception of reality. If I were to give you another example, you're sitting right now in Bhaidas Hall. You're looking at a screen, a stage, me, the walls, the chairs. If you were to be given a pair of glasses with a tree and a dog on it, and now you moved your eyes all around this room, on the screen, me, you wouldn't see the screen, you wouldn't see me, you wouldn't see the chairs. Everywhere you looked, you would see tree, dog, tree, dog. This would become your error in perception what is outside. The body, through a code, is telling you, this is my hard drive problem, please correct it. In an acute illness, these symptoms of this hard drive illness, which is a clue to what is happening there, are much more intense. They are more immediate. They are such that the patient can immediately explain and describe them very well to you. And thus, in such an illness, when you take homeopathy, you're changing not only the infections, the immunity to those infections, but your health in general completely. I would like to show you a little clip of a patient with dengue. Some of the biggest fevers that we have, malaria, dengue. Newspaper yesterday says, again they anticipate in this monsoon, leptospirosis, malaria, dengue. You've already seen with Dr. Shankaran a case of malaria treated with homeopathy, understanding what was this inner movie that was going on. I'd like to show it to you through the symptoms of a child with dengue. Dengue that creates panic, a viral infection where the platelet count drops. You would have heard of cases that are admitted to hospitals, need to be on IV drips, cases that are even fatal because of this infection. Let us hear her symptoms.
Concentrate on the symptoms during the day when the fever is low. What are you feeling? What are the symptoms you're feeling in the body?
I have a headache.
No. Headache. Tell me the kind of headache. What is happening inside your head?
It's not like a usual headache. It's
What is the feeling inside the head?
it's just compressed.
Compressed. So what are you eating and drinking through the day right now?
Orange. I eat a lot. I used to eat a lot, so an orange.
Describe it to me.
And it's brown. And has lots of pores. If you squeeze it, there's
Think of the word squeeze. What's the first thing you say?
I don't know. Oh, wait, sure.
Describe it.
It's really heavy and
Think of the word heavy. What's the first thing you say?
lead. Lead or wood.
Describe it.
Really heavy and dense.
So what happens when there is the lenses meaning what happens when you?
Only atoms are compressed in a small space.
So she started with a headache, which she described as a compression. As all homeopaths ask, what is it you want to eat? She says orange. From orange to squeeze, from squeeze to heavy, heavy to dense, dense to lead. And she describes it as heavy things, compressed, dense things which are compressed in a small space. This headache and compression, which presented as her key symptom in the dengue, as we explored the case through the food, through the fears, through the dreams, through every part of her life, it repeatedly showed this hard drive programming, this false perception, this movie that she had running inside, which was compressed in a small space. Through that, we prescribed the remedy for her that not only looked after her dengue, but it changed her entire health. During fevers, people often speak irrelevant things. You babble during fever. This babbling during high fevers is often the script of the inside movie that is coming out. The body is trying to tell us what is the problem by code and how do you sort this out. Let us hear her. What were you babbling?
No, yesterday. Oh, man. So thank you so much for taking so good care of me. And I'm so happy. I'm not sitting. I'm just 2 minutes just tell me how you're doing. That's fine. That's okay. Yep.
There's been a superimpositions of videos somehow, but during the fever episode, she talked of metals and chemistry. Her mother says, what were you talking about that for? It is not relevant to her life. She has dropped science long ago. And yet during this high fever, it is this inner story, this movie, this perception that showed through in what she spoke as well as her symptoms. As we prescribed the remedy, she was completely well. I'd like you to see the platelet count. As you can see, on the 15th, her count is 86,000. The normal count is 1,05,000, 50,000 is what is expected. And this creates a lot of anxiety. We have to monitor this carefully. This is the problem that can happen in dengue. Then after the remedy, you see the report on the 16th, the count has already gone up to 1 lakh. Go further, the next report on the 19th, you see it is very well within the normal range as to 2,60,000. This is the response with a follow-up that is there in cases with their reports, with the acute, and all such cases respond very easily with no problem whatsoever. And thus, when you take the medicines in this way, you cure infections, you cure the acute problem. You build an immunity so that such infections do not happen again. Or if they do, the frequency, intensity is much less till they disappear. But very important, in that acute illness, you have touched the immunity when it is most sensitive to both disease as well as to cure. And thus, you would take a quantum leap in health if during that acute illness itself, you recognize the problem, give homeopathy and treat the patient. Your little ones, our little ones come to us in the clinic and they say, we like you because you are a meetha goli wala doctor. You are not a proper doctor, which means that I don't give injections. But we hope that you will come to us for homeopathy because you want to take a decision, not one that will allay your fear, but one that will benefit your child in the short run as well as in the long run. For we all know that while man can make war, it is but the child who makes history. Thank you very much.